Hello everyone, I am Dr. Tanvi Rao. Today I will be talking to you about lymphedema. Now, lymphedema is something that you see all around but people are not aware about. So I'll just give a brief about the lymphatic system. Lymphatic system is very closely related to the circulatory system in the body. It consists of the lymphatic capillaries, the lymphatic channels, the lymph nodes and the lymph organs. This carries the lymphatic fluid from peripheries of the body back into the circulation. When there is a problem in the functioning of the lymphatic system, the fluid starts accumulating in the periphery and it does not get drained properly back into the circulation, resulting in swelling of your extremities, either your legs or the arms. And this process in which the swelling develops is called as lymphedema. What are the causes of lymphedema? Now, lymphedema very rarely can be congenital. That is, the child will be born with a problem in the lymphatic system. So that is one type of lymphedema. Whereas a secondary lymphedema is something that you acquire through your life. It can be either after cancer-related surgeries, it can be because of trauma, it can be because of obesity, or most commonly what we see, it's because of an infectious cause that is called as filariasis or even called as elephantiasis. Now, this is a parasitic infection that develops because of the bite of a mosquito and it causes bilateral lower limb lymphedema, which we most commonly see around us. Coming to the symptoms of lymphedema, the most common presenting symptom for lymphedema is swelling. Now, the swelling develops in either the legs or in the arms depending on which area is affected, and the swelling will slowly progress. It will go on increasing. The skin changes will develop, because of which the skin will become taut, it will become fibrotic, hypertrophy will develop, and there will be a lot of papillomatous changes on the skin. Other than that, they can develop repeated infections, redness and fever. There will be ulcers on the leg and lot of web space infections such as intertrigo. How do you diagnose lymphedema? Now, lymphedema is mostly a clinical diagnosis. When you go to your doctor, we will be able to pick up the lymphedema. But to assess the severity and grading, you will have to do something called as a lymphoscintigraphy scan, which is not available in all centers. But if it is not present, then you can go ahead and do a MRI lymphangiography. Coming to the management of lymphedema. Management of lymphedema is a comprehensive treatment which includes both non-surgical as well as surgical treatments. Coming to the non-surgical treatment, it includes something called as a complete decongestive therapy. Now, this CDT includes manual lymphatic drainage, where you do gentle massages to drain the fluid from the peripheries back into the circulation. It includes compression bandages. It includes limb elevation as well as physiotherapy exercises. Along with that, a good skin hygiene has to be followed. Surgical procedures in lymphedema will involve physiological as well as volume reduction surgeries. Physiological processes will be to bring down the fluid by doing a lymphatico-venous bypass or a nodovenous transfer, whereas volume reduction surgeries include liposuction to reduce the bulk of that particular limb, and also debulking surgeries to make the limb look smaller. Why do we need to know about lymphedema? Lymphedema, it tends to become a bigger problem as the disease progresses. It affects the mental state of the patient. They become social outcasts. Their limb becomes so huge and large that they feel ashamed to go out and attend social gatherings. They develop wounds on the leg which will not heal. It will become a chronic illness which becomes difficult for the patient as well as for the family to deal with. And that is why it is very important that we pick up lymphedema in the early stages. We diagnose it early, then we'll be able to treat it better so that we give a better quality of life for the patient. Thank you.